Right. Well, hello everybody, and going to give everyone a chance to start logging in and get set up. Give us just a minute or two as we start to just gather our people here and let the audience kind of log in. I see a number of you guys are getting in today, and pretty excited about our turnout. I know that we had over 400 people register for this event, which is pretty cool considering. This is I want to say this is like the fourth year that we've done this, and this group is really excited to bring this information to you all today. I will say, as we give me another maybe 2 minutes as we let everybody kind of log into this, and then we'll go around and do introductions. Just a couple of quick housekeeping notes. If you can put any tech support questions that you have, if you're having trouble with your audio or something like that, if you can put that in the chat, then our esteemed colleague is going to be monitoring the chat for that, and she'll be able to help you out with any of those issues that you may have. If you have any questions for any of the presenters, and feel free, you can put them in the Q&A throughout the session. We're going to be checking on those, and we'll even ask a few of your questions throughout the webinar. One of the things that I do like to say is for in the chat, one thing that's really cool, if you could put in there where you're watching from, right? And definitely this is designed to be a kind of an interactive thing, and I love to see where everybody's watching from, and definitely put some shout outs in there and talk with your fellow attendees in there. But if you have questions for any of the panelists, you can put that in the Q&A section on here. So I'm seeing we're starting to get just about everybody in. I'll go ahead and we'll kick off and we'll get things started. So just to introduce everyone, hi guys, my name is Glenn Hadley. I'm the Senior Vice President of Strategy at Dreamscape Marketing and Unlock Health. Joining me today, we have an esteemed panel of experts in their own right. They've each presented over the last year on trends that we've come to realize here as we kind of wrap up Q1 of 2024, and we're excited to bring them all together in this panel. Let's see. If you really like the information that you hear today and you want to continue the conversation with us, I know that we're all going to be out at numerous events throughout the spring. I know that some of us are going to be at the Winter Leadership Summit out in Tahoe in the blizzard coming up this next week. We're also going to be at TCIV East. We're going to be at BHB Value, NATAP, the West Coast Symposium, and more. So if you guys would like to continue the conversation with us in person, please look for us at those events. I'll also have an email at the end of this that you can email us, and we can put you in touch with the different presenters. So let me introduce everybody first, and we'll go ahead and kick it off and get started. So our first guest today is Dr. Bethany Nelson, the Director of Foundation Operations at the National Association of Addiction Treatment Providers, otherwise known as NATAP. Dr. Nelson serves as the Director of Foundation Operations for FORCE within the NATAP team, and earned her PhD in sociology from the University of Tennessee, where her research focused on criminology, identity, and mass media. Prior to joining the FORCE team, Dr. Nelson worked in both fundraising and program management for several nonprofits across the Southeast. So, Dr. Nelson, welcome. Thank you so much for being on the show today. Let's see. Next, we're going to have Sam Slayton. Sam is the Chief Executive Officer at Sante Center for Healing. And Sam's leadership over 2 decades has propelled the Sante Center's growth and excellence in mental and behavioral health. Starting in 2004, Sam's journey from working as a graduate intern to CEO has been marked by his commitment to a culture of integrity, family, and client-focused recovery. With degrees in business administration, health systems management, counseling, and psychology, his educational prowess underpins his visionary approach. Beyond his impactful work, Sam is an active community leader and devoted family man who loves Disney getaways. Get that? I'm a big Disney fan myself. So let's warmly welcome the transformative leader, Sam Slayton. Thanks for being on the show, Sam. All right, next we have a veteran, Michelle Milanese, the CEO of Prosperity Behavioral Health, the leading RCM and financial services provider for behavioral health facilities. She spent her career developing and scaling behavioral health services, She worked as System Vice President at Mainline Health and Vice President of Innova Health System, overseeing all mental health and substance use services. Michelle is also a licensed clinical social worker and Marine Corps veteran. Michelle, welcome back. Thanks for coming back to the show. All right. Next, we're going to have Dan Gemp. Dan is the founder of Dreamscape Marketing and a managing director of Unlock Health. Unlock Health is the largest healthcare marketing agency in North America, servicing clients from almost every state. Over the last 19 years, Dan and his team have helped treatment centers connect with and admit over 200,000 patients who struggle with substance use disorder. With the largest data set on patient volume in the industry, Dan brings a wealth of knowledge to this group today. And just welcome back, Dan. Glad to have you on the show again.
It's going to be a good one.
Absolutely. All right, next we're going to have Ben Dittman. Ben is the Senior Vice President of Partnerships at Kipu Health. Ben established Avea Solutions, an industry-leading revenue cycle management software for behavioral health treatment providers, and is now the Senior Vice President of Partnerships at Kipu Health, the top electronic medical records program, which recently acquired Avea. Before founding Avea, Ben spent 15 plus years in banking, system design, and consulting. And more importantly, Ben has been an advocate and a veteran of the show. So Ben, welcome back. Glad to have you here. Let's see. Next, we got Dexter Braff. Dexter is the founder and the president of the Braff Group. With 30 plus years of experience representing healthcare service companies, Dexter is recognized as one of the preeminent industry experts in healthcare M&A. Dexter has been the keynote speaker, panelist, or speaker on various issues regarding healthcare mergers and acquisitions or finance at conferences across the country. Dexter holds an MBA from the University of Pittsburgh, a Master's of Science from the University of Oregon, and a Bachelor of Arts from Cornell University, and received the Vincent W. Lanphier Award for Academic Achievement from the University of Pittsburgh. Dexter was inducted into the Home Care and Hospice Financial Managers Association Hall of Fame as Dealmaker Extraordinaire in 2018. Dexter, welcome back to the show. Glad you're here.
Thanks a lot.
And finally, we round out our panel today with Principal and Co-Chair of Polsinelli's Behavioral Health Law Group, Tani Weiner. Tani is a seasoned corporate lawyer with over 20 years experience in behavioral health M&A. And Tani regularly works with buyers as well as sellers, boasts an extensive track record of successfully completed transactions, and has the privilege of serving as a go-to counsel for legal matters in behavioral. He has been recognized as one of the top 100 lawyers in California by the Daily Journal in 2023 for legal excellence by Chambers USA. It's pretty exciting to have you on the show again, Tani. Thank you so much for being here.
Great to be here. Thank you.
Cool. So now we got through that. I'm really excited about this, having this group together today. And I'll tell you, the last couple of years of doing this, we've just been, we've kind of had the same, not exact presentation, but we've been moving in this direction. We've been talking about things that we all need to do in the industry as a field to kind of mature and grow up and be more aligned with traditional healthcare. And what I'm excited about this time and today is that this year's show is all about that change being realized. We are seeing some things this year that, like I said, we've talked about, but now we're actually seeing it. It's here. And so I'm excited to kind of dig into this. And I'm going to start off talking with Dexter about this because, you know, it seems like over the last 4 or 5 years, we've seen such growth in the space, and we've seen so many investment groups come in and invest in behavioral health, specifically addiction treatment. And yet we've seen a sudden shift in that, and we've seen a decline this year. And so Dexter, can you kind of start us off and kind of elaborate or talk about the different factors contributing to the decline in addiction treatment M&A in 2023, what we saw over the last year, and what's its relation to kind of the broader economic conditions out there?
Yeah, thanks, Glenn. So it's really interesting when we've analyzed this. The numbers across all healthcare services have basically dropped from the peak of 2021, dropped about 40 to 50% in 22, and another 40 to 50% in 23. Those are huge drops in deal volume. So what's going on? first, 2021 was an absurdly busy year. People were making up for deals that were not done during the pandemic. Interest rates were essentially, as close to zero as you could get, and buyers were on top of each other to make acquisitions. And behavioral health was definitely one of the key areas that people were looking at, and substance use disorder among them. But what happened was that starting around back end of 2022 and the beginning of 23, we saw interest rates rising substantially. Inflation started becoming real difficult. The staffing shortages were extraordinary. Unrest in Ukraine and now in Israel. All of these factors spooked buyers, and really spooked buyers, such that the pullback was dramatic. And the pullback has been globally and across all industries. So when we map out the total number of deals that have been completed from 2019 through 2023, the pattern that we've seen globally across all industries is virtually a mirror image of what we've seen in healthcare services and what we've seen in behavioral healthcare. So what that suggests is that the down swing in business that's been experienced is much less a function of anybody not being interested in behavioral health or addictions, but much more a function of the macroeconomics that have impacted all industries worldwide.
Interesting. So like with the macroeconomics that are going on, like what do you think about the M&A outlook for this year, considering seeing that downturn? Do you think that we're going to continue going in that direction, or do you think that we're going to see maybe a flattening out of that curve this year?
Yeah, so before I do that, two good things that happened in behavioral. I had to dig deep to find them, but I found them. In the substance use disorder area, one thing that was very interesting is in outpatient PHP, IOP, and counseling, we had a record number of transactions completed in 2023. It's one of the only segments in all the segments that we track that we saw numbers going up and going up dramatically. They doubled what happened in 2022. So not entirely unexpected. The movement has been towards outpatient services for many years, but this is one of the first years that's manifested itself in a very big way in the PHP IOP counseling area. So that's good. And the other good thing is in the platform transactions, those private equity market entry deals that we've seen. In behavioral health, the numbers didn't go down from 22 to 23. They were, in fact, there was one additional deal, went from 28 platforms to 29. But if we look at all the other segments that we cover and look at platform transactions, the platform deal flow dropped 46% in all of the other sectors that we cover. And so behavioral health held its own. And we look at platform transactions as a good market indicator of what we can expect going forward. So there's no shortage of interest.
Okay.
Going forward, I think the most important things are the Fed has signaled that they're probably going to be doing the first of a series of rate cuts beginning in the spring. That will help things out dramatically. The staffing issues, while still problematic, are getting better. Inflation is at the Fed's target rate right now, which is 2%. It doesn't mean that prices aren't still high, but they're not going up as much as they were before. And buyers have been on the sideline. I mean, it's not been a year, it's been 18 months. Buyers have been largely on the sideline for 18 months. They just can't stay there. They can't. So what do we expect this year? We expect to see the industry bottoming out, if you will. We expect to see an upturn over the next 6 to 9 months, but we expect to see more of a full recovery in 2025.
Yeah, because like you said, they can't just sit on the sidelines, right? Like we're going to get back in business again. You know, you and I were talking a little bit earlier before we got this thing started, just about some of the interesting things that we've seen at the deal table, like some things that maybe weren't there before. And what are you seeing like as we're getting closer to the deal? And then Tani, I'm going to bring you in after this to kind of elaborate on it a little bit more. But like, what are some of the things that you're seeing at the table that the investment groups are asking for that maybe they weren't years before?
So it's been an extraordinary 18 months or so, where we've seen quite clearly the extraordinary trepidation that buyers are bringing to the table. We have had no shortage of letters of intent being signed. We have had no shortage of companies making it through quality of earnings. And in our world, once you get through quality of earnings and you get a confirmation of purchase price, the likelihood of close jumps up to in the 90% range. And in the past 18 months, that percentage dropped below 50%. And what's happening is that buyers are getting all the way up to the finish line. And then for reasons that would not have stopped deals from being closed in the past, buyers are pulling out of transactions. It's simply a function of that fear and a carryover from the economic difficulties that the industry has faced, not behavioral, the whole world has faced over the last 18 months. So it's been difficult. It's been frustrating. Deals are getting across the finish line. It's not like there's nothing that's happening. But from a trend standpoint, it's the most nervous that we've seen buyers, much more so than we saw after the global meltdown that we saw in the 2009 period of time.
Yeah, and I think it's one of the reasons why I'm excited to bring this content out there, because we are going to share some solutions for that to really set that, you know, that fear at ease for buyers out there. Tani, like from your perspective, what are you seeing with your trends, especially whenever operators and buyers are going through due diligence? What are you seeing there?
There's more attention, as Dexter said, to quality programs. Buyers who are willing to transact in this economy don't want to risk things that they might have when all the boats were rising. People are a little more concerned about not just the traditional legal hotspots or their like liabilities or business practices that we don't want to take the risk on, and we'll put that in a purchase agreement to get indemnification for, but truly intrinsic to the go forward financial health of the business. A key issue that everybody knows, and we have great representation here to talk about, reimbursement. How are your payer relationships? Are you in network? If you're not in network, much harder to sell. If you are, that's great. But if you are and your buyer does a chart review and finds that billing and coding isn't all ticked and tied, or isn't ticked and tied enough, their counsel, and when we're on the buy side, this is one of the things we look at, will say, look, going to have to clean this up. And then cleaning it up is going to mean that maybe the performance in the future isn't going to be as rich, because you got to do things a little more conservatively. That is not just a risk allocation issue. That impacts fundamental valuation concerns. And you can really get into a spin there. Dexter's recommended it before, and we totally agree. If you're looking to go to market, spend some time on the prep, not just on getting your financial house in order, but anticipate that you're going to have a buyer with smart counsel who will want to look around corners and make sure that the business will pencil out even in this somewhat more challenging economy. There are some additional regulatory hotspots and approvals that are here that people are being mindful of. For one thing, given the differentiated perspectives on the buy and the sell side on valuation, choppy economy, we're seeing more people go for earnout formulas or rollover equity. And those are a good way to bridge a gap to reach an agreement on valuation, but they raise legal complexity issues, regulatory complexity issues, particularly given the heightened regulatory scrutiny in the behavioral health space. Glenn, as you said, behavioral is catching up and being more regulated, like what has traditionally been the norm in the American healthcare system. And so you can't just find what is a good like business solution in a widgets business anymore. You really have to be mindful that kickbacks, eliminating kickbacks and Recovery Act, and similar things that could be perceived as, it's not patient brokering when you're structuring a deal like that, but the laws are written so broadly that you have to find ways to be compliant with that and avoid creating an issue on top of the risk issues that there may be in diligence. And so those are part of the suite of issues that we see coming up on the path to getting a deal done once you're able to pencil out the financial and LOI aspects. Among others, I'll pause for sure.
Yeah, just a quick question, because I know that we've talked about in previous years, we've talked about the maturation of this space and how we are starting to, for lack of a better term, grow up and be considered more in line with healthcare, with traditional healthcare. What are some of the kind of the differences that you're seeing from years past now that maybe like whenever it got to the deal table, it wouldn't have been considered before, but maybe now it is a barrier because the buyers are actually maturing as well to see like what they need to ask for? What are like maybe a couple of those that weren't a big deal before that are a real big deal now?
For sure. So fraud and abuse, candidly, are heightened concerns. Patient acquisition, are you, when you're bringing patients in addition to just not having payment to marketing reps that's tied to each admission, that is straight up patient brokering and is now criminal due to the ECRA law that came in a few years ago. Its presence is becoming more known. Operators are becoming more aware. The quote industry norm is moving more towards compliance with that. And I think it's a little bit driven by, there have been some, high profile regulatory enforcement issues that have been trickling through the system. So people are heightened concerned on that. If you have compensation arrangements that look or smell like more pay for people in exchange for incrementally higher admissions, that could be perceived as and potentially include one of the things that this law is intended to prevent. And so people have to be a little more mindful of how they structure those arrangements. We've seen a lot of clients getting more smart and coming to us and saying, hey, well, gee, how do we do this? We've always done it a certain way before. The additional twist on that is external referral relationships. If you have, Florida model recovery homes, recovery housing, and IOP, PHP, you can't give away the housing for free or below cost. You have to have some way to compliantly provide both levels of service to your patients, or it is perceived as you've given away something for free, i.e. Housing, i.e. Plane tickets, i.e. Like donations to nonprofits. There was a big case in New Jersey. I think it was called Recovery Advocates. We came across this in one of the deals we've done, and some other providers have gotten stuck, and it made headlines that there were, money going into a nonprofit that was then cycling referrals back to rehabs. There's a lot of creativity and passion in the space, and that's wonderful to connect patients to good quality care, and we fully support that. But the environment that we're working in now has this additional level of what has been historically normal for the American healthcare system, but now being more present, and people will look into it. One additional and maybe last thing to be mindful of, and I think Dan will have some things to say about this, we've seen an uptick in enforcement activity in privacy on third-party web tracking technologies that treatment centers may be using in their marketing and patient acquisition activities, and the information that's gathered and shared with third parties through those means is considered PHI and or state law level protected health information. We've had some recent upgrades to the HIPAA equivalent for substance use called 42 CFR. And so all of those things are creating heightened things for buyers and their counsel to be anxious about. They want to make sure are buttoned down before they transact. And folks who aren't in the market should be mindful of these same things as well in their day-to-day operations, to not get caught up inadvertently in something that seems okay, but creates with it legal risk with present-day real-life enforcement activity behind it.
Well, and I appreciate you saying that. And Dan, I'll get to you on this, because it has been something that we've seen across the board with around privacy data that maybe we had never seen. I do want to get to an audience question real quick, and I'll open this up to the group for a minute, because it does kind of hit on all these things. But Tani, if you could address this first, and then maybe a couple of you from the audience or from the panelists can answer the rest of this. This is from one of the attendees. It says, what are some practices, marketing, billing, et cetera, still commonly in use that are in the gray area and put providers at risk from the regulators or from blowing up a deal with a potential buyer? So Tani, talk about the gray area, and then if any of y'all want to chime in, please feel free to.
Very well. If your billing doesn't match your licensure, so if you're doing PHP IOP and that's how you're licensed, but your payers can come in and say, well, gee, that looks a lot like residential. You're doing services outside of normal hours. There's activity on the weekends. This is residential care. And right, in most of the world, if you're giving something to a payer of higher value, residential level, and you're only billing them for IOP, PHP, lower cost, like the payer got a windfall and, got more than they paid for it. Here, payers will recoup that. They'll say, nope, it didn't match. And they'll be pretty strict to make sure that these technicalities are met. And does it help anybody? Does it help patient care? Does it help providers? No, the only thing it helps is the payer's pocketbook. So they will be particular on issues like that. We have seen areas where corporate practice of medicine is used to deny or delay claims. Similarly, like there's in many states have clinical care, states that have the corporate practice of medicine, they have to be in a professional corporation, friendly PC. This is a very common arrangement in medical dental practices, not very common in behavioral. Most behavioral providers are operating somewhere in we're kind of below the radar. We don't have core clinical. It's just a little part of our business. Well, payers are looking at that and saying, hey, you're a regular company owned by regular investors, not a doctor. We're not going to pay these claims because you're not a professional corporation. We're just going to deny it. And so it's not, again, material in the real world to delivery of care or the substance of what a provider is going to do. But payers are really out on the hunt for ways to reduce and constrict revenue. We've seen ghosting by payers where they don't even tell you what the issue is. They just delay credentialing and slow walk it, and the revenue cycle builds up. We had a talk with Michelle's colleague, Greg Keelan, on this in the trade press. And when it was out, we got a bunch of people saying, my God, that's happening to us also. The payers kind of disappeared. They haven't told us what the hell's going on, but our claims are going much longer and slower. And payer people we're talking with are, just giving us the same old runaround. We've been able in some of those cases to help clear up the blockage, sometimes suggesting that we don't want to have to sue you, but our clients have hired us to do that if it's needed. So that's an example. And then maybe to round it out, quickly, this is payer stuff. There's something called incident to billing. If you have clinical care by a doctor, and then there's like all these lower level practitioners, and that's clinically appropriate. But if you haven't appropriately credentialed those lower level providers, and all the billing is going through the credentialed doctor, and or if there's other doctors who are billing under the first doctor. This is not uncommon in behavioral, where you've had entrepreneur built companies who are scaling to meet patient need. That's totally cool. But if you haven't gotten the math done, and particularly if you're receiving government pay funds where the fraud and abuse concerns are much higher, you are really running a risk. We call this the iceberg issue. You just sort of see right at the beginning, well, hey, wait a second. How did this one tip of the iceberg physician, how did all that stuff billing wise flow right from that there? And so when this issue comes up, it is a significant concern that can be addressed and resolved, but it requires work and also ounce of prevention much better than trying to figure this out in the middle of the deal.
I'd like to.
Yeah, Michelle, real quick, can you elaborate on that? Because I know that Tani, pointed to you guys over there. Like, talk to me a little bit about what you're seeing, and then I'm going to throw it to Dan to dig into the marketing side of it too, so we can like put this question to bed. So, what do you see?
Yeah, so just in terms of billing practices that are still I think the question was billing practice that we're seeing that are still kind of questionable. We still see a lot of facilities accepting out-of-home network payers, home network blues, et cetera, that are known to be higher paying policies. So it's technically legal to, of course, accept somebody into treatment with a different home plan. What happens though is the payers are catching on. And if they see a large number of a home plan from an area that is pretty far away from where treatment is actually being provided, and there's no obvious clinical reason why people from one geographic area of the country would be traveling across the country, say, for treatment that's kind of available and all those miles in between. The payers are aware of that. They are flagging it early, and they are putting it into prepayment review. So that would be my word of caution is, of course, it is okay. And if you have clinical availability or treatment that is available, and it's the right fit for the patient, of course, take those plans. But when payers see that happening in large amounts in a concentrated time frame, that is going to raise red flags. And they will put you. It's not just they're going to ask the question. You will be in PPR and have zero cash flow coming in a matter of hours.
Right on. And Ben, I know you wanted to jump in there. You were going to add something as well.
Yeah, I mean, I kind of tagging on Tani with the down billing issue. That down billing issue is it has systemic issues for the entire industry because the payers are actually using that claims data to align with outcomes. So if you're delivering residential care and you're only giving somebody PHP or billing PHP or IOP, they're getting a higher level of care, which is most likely going to give them better outcomes. But the payers aren't going to see that. So what they're going to start doing is ranking authorized days. And so as we get into value-based reimbursements, as you get into negotiations, it's a practice that it's better to have better communication with the payers and at least inform them or market.
And
Absolutely.
Glenn, I'll add one more thing that we see in individuals who call or families that call to seeking treatment services. There's a lot of facilities that we're aware of that completely waive coinsurance and deductible, and they'll tell people to come in with nothing. They make no attempts to collect on that coinsurance and deductible, and that's their way of not necessarily promoting quality care, but breaking all financial barriers of people coming into treatment. And so that's something we have to compete with because you have to, collect the coinsurance and deductible. So.
Yeah, and I think that's probably where I see one of the unintended positives out of this shift in on the business side of our industry is that that's is definitely being called out more and more today. It's not going to be as readily accepted as it was before, and clearly it isn't. We're sitting here talking about it today instead of warning people about it. We're actually saying, yeah, this is here. Dan, why don't you talk a little bit about the gray area in marketing? I know that was called out in the question too.
Yeah, it's interesting because it's like the second cycle we've seen of this, right? There's a lot of new market entrants over the last few years since initial enforcement came onto the scene. A lot of people would time this in the pre and post legit script era, right? Buying calls is extremely dangerous. If you're buying calls on a pay per call basis, that could easily be reverse engineered into a pay per patient felony. And I know that Tani can't tell you whom, but he has seen that. And there's phone security issues as well. So if you're not doing a medical utilization review to assess where you're referring a patient, and it is a financial incentive to direct that phone call, you're in violation of lots of compliance issues. So we are getting to a crossroads where your marketing does now require compliance. And it is tracking pixels from Facebook and Instagram. It is, some of these solutions are inexpensive. Your Disabilities Act, your website needs to be disabilities accessible, right? So there are plugins for ADA accessibility that are $50 a month. And we've mentioned them to groups who say no, they just choose not to do it.
Buy it. You want to pay Dan 50 a month, or do you want to
It's
pay
not me,
us
it's a neutral third party. It's a neutral third party.
or whoever? Yeah, just
But it's a lot cheaper to buy a plugin than it is to have to afford Tani's hourly rate. So unless you're doing the $50 an hour again, Tani.
only for you, Dan.
So I think that, you know, there is a trust factor, right? The industry has shifted in marketing from marketing hope, right, as it matured, into marketing trust. But if you're going to be marketing trust, you need to be certified, compliant, really leading with data and outcomes. And I think that those are all being under scrutinized in the industry.
I think it's interesting. You know, we've been here talking about this. I don't think I've ever done one of these where we've said the word compliance more. It's pretty interesting and exciting, I think, to be talking through that. I want to get into the marketing in a little bit more detail, but please keep your questions coming. Really appreciate those, guys, and we'll definitely ask some more throughout the show. Dan, we talked a little bit earlier, like about saturation of marketing practices, and we got like 30,000 treatment centers out there that are all going after patients in a very similar way. Talk to the audience a little bit about how their own marketing from the operator side. How can they stand out? What can they do that's different rather than the same old same? Because we're seeing that it is saturated today.
Yeah, and I think that the clinical models and modalities don't really differ drastically across, you know, providers. What we have seen that has been successful, right, is making that leap into corporate marketing, market like a health system. And there's a hesitancy to do this in behavioral health, and we don't quite know why. No one is taking us up on this, but if you led with your outcomes data, and I think everyone is fearful that relapse and recidivism and outcomes data is a bad thing, or that these numbers are too low, you'd be shocked at how trustworthy just publishing your AMA walkout rate can be, right? If you simply advertise the percentage of patients that complete the recommended course of treatment, it doesn't need to be long-term, university verified, multi-study kind of outcomes. It can be surface level. Are you properly serving the patients who come to you for help, right? Are they getting what they need? So I'm going to say that, again, this theme of trust in marketing is going to be the leading driver of delineation between you and another provider starting this year in depth. And I mean security as well. You need to advertise the security of your information systems, of anonymity. HIPAA compliance matters a lot, but in your marketing, you can't have, oh, it's just an Instagram tracking pixel, blah, blah, blah. It's always been there. To put that one to bed, let's do a show of hands on the screen. How many people have chosen a medical professional because of Facebook or Instagram this year? Right? No one even shops for a dentist that way. So get rid of the pixel, because it's not helping you anyway. It's not going to drive new patient volumes. I would say scrutinize your own website as though you're a regulator, right? There are reporting functions at NATAP now. You can report bad actors who are bidding on trademarks as keywords, who are violating other best practices in marketing. LegitScript has been leaning much further into quick turnaround of enforcement for bad actors on paid ads. And then I want to give everyone a newer idea to focus on this year. So we're entering the age of AI, right? And it is going to grow at a terrifyingly exponential rate. You can't just trust it, right? You do need to be writing your own content with humans, else it will accidentally claim to have a cure for addiction and publish that on your blog, right? So be very, very careful that you're still using humans. But there's a huge advantage to this, right? As we get into the age of AI, those who are feeding content and audience personas into the robots, right? Teaching them that information, you'll find your results are preferred by the early stage search algorithms, Google search results, that are factoring in AI. So if you are the instructor to the robots, you will be preferred by the robots later, to oversimplify all of AI, right? And this factors into PPC, this factors into SEO. Google and other advertisers have had 20 years to track you as a person. They know when you're sleeping, they know where you are, they know when you're in your car, right? They don't need to track individuals anymore. They have already determined your proclivities. They already understand what you're going to do next. So now they don't track you at the individual level. You simply fit into a buyer persona and what you're likely to do in your medical shopping, right? We are all very, very predictable. So factor that in as you look at your own marketing. Would it work on you? Don't waste budget or compliance risk on channels that are not going to be fruitful anyway. Don't buy calls, and realize that your website has actually reversed polarity, right? It used to be brochureware and you were projecting information outwards, and now it is an informational database for AI and search engines, where those tools will be narrating your website's information to a consumer, right? So there's now storytelling involved, and you have to write a good story, as opposed to brochureware and you had to pay or outrank someone to get eyeballs on your website.
So on that, like, because we're seeing so much increased competition, like how does a well-planned marketing strategy impact budget and ROI? Because we hear that so often where operators will come in and talk to us about ROI, like up and down, left and right. Like, how has that been impacted, and what are you seeing as the industry is maturing and moving towards a higher standard? What are you seeing that as a marketing strategies mature and reach a higher standard?
I'm uniquely sensitive to this right now. Big thanks to Amulet Capital for funding the new Unlock ROI Insights tool, but we have had to build a software solution to this problem, right? Calculating ROI in this space, we've seen groups that don't factor in their full-time employees' payroll cost. We have seen groups that view organic SEO, kind of earned media, as the same as Google ads, which is paid media. You're kind of just renting that. You don't own that market share. And so we've seen ROI calculated differently from a marketing perspective on every M&A deal in client reporting. There are different values, right? An alumni coming back to your treatment program, that should be a very low cost or no cost of marketing involved in that, right? That's a trust relationship that drove that admission. But if it's attributed to a marketing campaign, does it bring down your average cost and kind of diminish the results? So use tools. I think that more than ever, your marketing needs to be measured by high-tech software, any high-tech software. Build your own dashboards, build your own reporting tools. But a quick example of this would be, sure, you can have contact forms on your website, or you could generate a health risk assessment, which actually obligates you to follow up with a wellness check and make sure that medical treatment was provided to that patient. And so instead of having a simple contact form, add a few, questions about level of crisis or self-identifiers, and build a secure health risk assessment, or use ours. But in that scenario, you've evolved from a contact form to an actual patient matching lead generator, right? Budget is an issue. So with ROI, there's a great irony to this. I spoke about this at an investor conference, but underspending by 5% is infinitely more risky than overspending by 5%, because Google's business model is an auction. So if every single time there is a bid at the auction, you underbid, you will win 0 market share. You will lose all the time, every time, right? Or you'll get the second best result. But if you overspend by 5%, then your biggest problem is simply that you overspent by 5%, but are still drastically profitable, successful, and have gained market share against competitors. So using these tools, these dashboard tools, and AI live chat and health risk assessments, and all these wonderful tools, put them into a marketing funnel that you can measure at each stage with a cost per everything metric, right? You should be able to evaluate a true cost per everything and set your expectations against that, right? Don't go tell your marketing team, spend 10% less and get me 10% more census. That will not work. Marketing is an investment, not a cost, but it scales linearly in most cases. You don't just conquest the entire United States against all of the enterprise operators in the space, right? You can't just buy market share outright. And then with that measurement, I would say that you need to look at all of your data sources, right? So your CRM, Kipu, your EMR, your billing software, you need to take that data and feed it back in based on the best payer mix, the best fit patient, the audience persona that best connected with your clinical approach, and adjust your marketing each month. I don't think this needs to be daily, but each month adjust that audience and where your marketing dollars are going. And that's how you're going to get efficiency, not by lowballing the bid, right? Use these partners, have your billing partners, talk to your marketing partners, talk to your software partners. They'll solve the problems for you. I've been on so many calls where the client can just sit there and say hi while the vendors all hash it out and play Brady Bunch on these Zoom squares.
Yeah, we've definitely seen a lot more integration between the tools in this space. I do want to bring up something that Dan, you mentioned AI. It's been mentioned a number of times on the call, and I'm sure that if you've consumed any mass media out there, you've heard it. And so I'm actually going to shift to Ben for a minute to talk a little bit more, expand a little bit more on AI, and like, what are you seeing with the use of AI in clinical documentation? Like, I'm very curious about that, because I heard at an event last year that there were some medical professionals using AI to actually do some of their documentation. What are you seeing? What's new out there in that?
Yeah. So, I mean, it's kind of crazy. We're about on the 1 year anniversary of ChatGPT being known by everybody. So within, I mean, literally last year, I remember showing people ChatGPT in January and them having no idea. And then all of a sudden it's now a household name. And that's just spawned this huge, kind of AI revolution. When it comes to clinical documentation, so there's actually quite a few organizations out there or technology companies that have been working with AI and clinical documentation, and then there's a lot of new up and coming ones. It's exciting to see the impact that it's having out in the field. So we recently, one of the groups that we partner with, we look at a bunch of different technology companies, but Elios, for instance, is out there and it overlays into our system, records the patient session, actually turns around and tracks things like clinician talk time versus patient talk time. It will actually look at the therapeutic modalities being used in the session and identify CBT skills, action planning, etc. And what we see is initially the reaction for people in the industry is like, okay, maybe I can do more sessions. But the reality is it impacts burnout. So people are now looking at this as this augmented intelligence that helps them do their job. The patient feedback is that they have a 2 times better engagement during the session. We've seen a 3 to 4 times increase in therapeutic modalities being used as a result of tracking it. So it's a huge impact on what ultimately is patient care. The other part is we see treatment centers adopting it from a competitive advantage. So if I have it and my team uses it, why would I go to another place that doesn't have it after having this assistance? So it's been pretty exciting.
I think it's interesting. A few years back, I started a program, and one of the benefits for clinicians is we said, come work with us. Like, you won't have to worry about your clinical documentation. You're just going to be able to help people. And now, like, we may actually be getting to a point where that can be true even in a very clinically minded facility, right?
Yeah. And I mean, again, you're not taking the person out of it. Everybody, just like Dan said, you need to review the documentation, but it should be doing 80% of the documentation and actually making it better. And then it should be reducing the documentation time by at least 50%.
Right on. Now, okay, we talked just a little bit about AI and some of these other systems. With there really is, whether it's marketing, whether it's billing, whether it's compliance. There's so many softwares. There's so many services out there. Like how does an operator, and Sam, feel free to chime in on this too. Like, how does an operator like keep track of all this and manage like kind of system overload?
I mean,
Oh,
yeah, go Sam.
go ahead. I mean, I honestly think that you have to have colleagues around you. You have to be able to constantly have relationships with people that you can trust in the industries across everything, because you can't try to be the expert of everything and think that you're going to run an organization well and not lose focus on your purpose. So it's people like Ben, it's people like Dan, it's reaching out to these colleagues to see what is going on, what you're looking at in the future. And so trust is a huge thing. It's always a risk in making any changes, but I truly believe an inspirational operator, you innovate or you die. And so you have to be able to make changes and take calculated risks without compromising your clinical integrity and your purpose of the organization. So.
Right on. What about you, Ben?
Yeah, I mean, I think it's one of those where you need to do an assessment. All this technology is coming in and people are overloaded. So you need to do an assessment of what you're using and how beneficial it is. And then clinical adoption or clinical adherence is going to ultimately impact patient adherence. So, get some technology people internally to pilot it, get them as promoters, and then you're going to have a better internal, adoption. And if your internal team's adopting it and they're using it, then as you look at like outcome measurement tools, you're actually going to see a better engagement from patients.
Right on. I'm gonna shift gears for a second because you mentioned outcomes and Dr. Nelson, do you mind jumping in and can you talk about the importance of outcomes and measurement-based care and demonstrating the value and quality in addiction treatment from an organizational standpoint? You really do have that viewpoint at the industry overall. What are you seeing as it relates to outcomes?
Sure. So thank you all for letting me be here today. And outcomes is one of my favorite things to talk about in addiction treatment because I think it is central to moving the field forward. Glenn, you said when we first got on the call that the last few years we've really focused on growing up and aligning ourselves with medical science. And I think tracking our outcomes is really one of the best ways to do that. We know addiction treatment works. We know people get well, but we have to be able to demonstrate that they're doing it, in what cases, in what ways, how we're supporting them. And this gets back to something that Ben mentioned even. It allows us to do quality checks on ourselves. So if we are down billing, we say, oh, we did it on this one particular instance for this patient. Well, if you're tracking your outcomes, you're tracking the demographic information, you're tracking your release codes, you might see that this is actually a pretty standard practice that you engage in which case, once you've identified it as a problem and aligned it with your outcome measures, you can make changes to it. And this goes back again. So I feel like we've talked about outcomes so much already. Dan, you mentioned that we're talking about marketing trust and just releasing any kind of information. It adds to that transparency and people are going to trust us. And measuring your outcomes in a way that allows you to communicate them effectively is incredibly important. And I feel like sometimes when we talk about outcomes and measurement, it gets a little scary in addiction treatment. You don't want to put more work on your clinical staff. You think, I took statistics when I was in my master's program and I never want to touch statistics again. But you're already collecting all of this data in most cases, you're collecting outcomes data already. You're just not managing it in a way that makes it work for you. So you don't have to add a ton of work to track your outcomes. And then if you get into it and you say, oh, we're missing data like 70% on race and ethnicity, it gives you opportunities to then start working with your staff on issues of diversity, equity, and inclusion training. So outcome measuring kind of just it's more than just about the outcomes. It's about our performances. It's about marketing. It's about how we elevate ourselves and our patients. And so I don't know that that gets really to the heart of the question, especially around the integration piece, but I think this call's shown it's integrated. It's in every area that we touch.
Yeah, I think integration is a good point. One of the things that I've noticed in some of the interactions that I've had in either other areas of healthcare and wellness, I've talked to some of the more traditional operators of medical systems and then some senior living operators, and I've asked them about the integration of behavioral healthcare into their programs and into their business models and up until really up until late last year, I got the same kind of thing. Like, we don't really understand it. We don't get it. We don't understand what happens over there. But I'm starting to see more and more interest. What are you seeing with like behavioral health integration? How is it being improved? What are you hearing from outside of our industry and with other parts of healthcare?
Sure. So when I'm thinking about integration, and it's interesting you framed the question the way you did. So often we talk about behavioral health being integrated into primary care, or we think about it in emergency care where they're doing desperate screenings when people are coming in. But when we're thinking about, there's a lot of innovative tools in trying to introduce primary care back into behavioral care as well. At the NAATP conference, we're actually going to have somebody doing an entire panel on that. And at the heart of this question, what we're really wanting to have happen is no wrong door. Whether you go to the emergency room and you get the behavioral health care you need, or you go into behavioral health care and we've done some screenings around infectious disease or given you a really good physical, we want wellness for the whole person. And so when we're tracking our outcomes, we're measuring one particular type of wellness. And most behavioral health care centers don't want to be primary health care centers. This is going to make a huge nightmare in terms of billing, in terms of purpose, everything, but we can work on systems for screening. We can work on warm handoffs with folks. We can work on building up community resources. And a big part of this is making sure that we're paying attention to the social determinants of health of the clients that we have coming in. And we need to be looking at their recovery areas, so to speak, their recovery environment, looking at housing, transportation, food security, and making sure that we're connecting them with all the resources that we can. And so when we're thinking about this integration of primary care, behavioral health care in the spaces, it's really an inclusion issue that happens not just in our facilities or in healthcare facilities. It's truly a community issue that it expands out to.
So with that in mind, thinking about as a community issue, I'm just thinking about the need for a broad perspective from leadership and being able to see the big picture and how all of these things fit together. Like how are you seeing leadership address this, and are you seeing both inside addiction treatment in our space, but also outside? How are you seeing that move there? Is it a more open perspective, or are you still seeing like some holdouts?
So from my current perspective, it's growing so fast. I've been with NAATP for around a year. We've more than doubled our sites. We've more than doubled the kind of conversations that we're having. And I'm so thrilled. I started and I loved the project and I knew we were going to be doing good work. But it just seems there's been such an openness over the last year to people wanting to talk about outcomes. And when we get you on a call and we're talking about outcomes and we start to mention issues of diversity, equity, and inclusion, there's not as much of an arm's length approach to it anymore. People are starting to ask questions and self-investigate. Outside the field, I can't say that much. I don't get to work with a lot of people outside of addiction treatment itself, but the people that I do work with give me so much hope, because if they're leading the conversations with others in their treatment spheres for their patients and advocating for them the way that they do when they're on the calls with me, and the data that I'm seeing from them, like, we are in a fantastic shape.
That's great to hear. And I did want to say, I did see a question in here that I wanted to ask. It was directed for you, Bethany, and I think you touched on it, but I think it's such an important piece. I really do want to make a point of it. The audience member said, can you share an example of an SUD outcome metric that has been used successfully to build collaboration with hospitals, health systems, EDs, effectively for collective improvement efforts. So yeah, can you share something along those lines?
Sure. So within the guidelines that we use for force, we tend to rely a lot on the predefined like behavioral health skills. So we have a lot of PHQ-9s, we have a lot of GADs, we have a lot of BARCs, and anything that allows us to speak the same language. You're going to see things like the BARC used in hospital systems and major healthcare systems. You're going to see things like the PHQ-9 used there. So anything that allows you to start speaking the same language. And I think most of the ones that we use are available for free, and they are well designed and wonderful. So if you need possible outcome resources, different tools and metrics that you can look at, please email me. I have a whole guide that I can send you over. You can read about the benefits and the possible troubles with some of them, and it gives you a lot of options to really think about what you would want to do, especially if you have multi-site or you're trying to work with other sites. It's a good place to start.
Wonderful. Thank you so much for that. And I want to take the kind of the leadership discussion and move it from the industry as a whole down to the operation level. And Sam, I'd love to talk with you. One of the things in preparation for this that I thought was so refreshing and exciting is that, you know, whenever we talked about what you really wanted to exemplify, is you wanted to talk a lot about culture and culture building. And I thought, how refreshing is that to have a real conversation from a leadership perspective about culture inside the walls. I really can't remember before really, you know, before moving into this new kind of phase in business that we would have this conversation. So talk to me a little bit about that and what you're doing there at Sante around cultivating a strong culture and why it's crucial for you guys to provide the care that you do.
Yeah, absolutely. So I'm a huge cheerleader for culture, mission, vision, values, servant leadership. And I think it all starts with your why, Glenn. And for us, our why that you'll be able to ask any employee here what that is addiction is a fatal disease left untreated. And that's it right there. I think it's very easy, especially from an administration side, for people to get lost in the numbers, lost in the metrics, and forget that every person that crosses our threshold has a story and that they're powerless to the disease of addiction. They've suffered trauma, co-occurring mental health. And so to not lose the humanization of addiction treatment. And so we have our mission and vision quite prevalent across the organization. But our principles are what defines, they're our actionable guide to what everyone can do here to contribute to someone's their stay here at our treatment facility, their aftercare. And so it's really building that culture of autonomy within the organization that regardless of your position here, if you're making a decision within the parameters of our principles, whether it ends up being the right decision or the wrong decision, it's focused on our patients and their well-being and giving people the autonomy, inspiring them to be able to make decisions without there being silos, without there being departmental silos. It is freeing, but it also is empowering and ultimately helps the outcome and the experience for our patients here at Sante. We've had a very big initiative here in doing CEO book study with employees, where we go through leadership books, where we go through books that talk about vision, where we go through more in depth than customer service readings, but making sure that we're all on the same page. We all have to walk together, understanding what our mission is, and we all have to know that innately we're here to serve others selflessly. And I head that up with a lead first mentality. There's nothing here that I wouldn't do that I'd ask you to do. And so that's really important to me, you know, being able to inspire in that way, putting service ahead of self-interest is good. And we have a real simple cliche mantra, you know, you do good things happen. And so that's not only investing in our patients and their families that are here, but investing in the community as well, and trying to find those areas where access to addiction treatment is not as high as we want it to be, and trying to partner with the court systems here, with community outreach programs here, and trying to help facilitate access, regardless if it's at our facility or not. Our goal is to help get people the treatment that they deserve, and then be able to convey hope, because that's what we have to do, is convey hope that recovery is possible, and it's worth it, and they're worth it.
One of the things that that I'm very curious about, both Dexter and Tani talked earlier about the just the increased scrutiny at the as it relates to the influx of investment capital into the space, and the challenge around that. How do you balance the business aspect of actually running a business and the dollars and cents that go into that so effectively with culture building? Because they on paper, it's very difficult to bring culture to the deal table, right? And the other, we know it's important. Anecdotally, we really know that it's important. How do you balance that out with your strategic planning within your organization? Because I will tell you, most people talk about it, but to actually do both of those things effectively is very special. So how do you do that?
Yeah, so obviously behavioral health is its own unique space, right? And so a majority of the people we work with have a counseling background, or have some experience in addiction treatment themselves, recovery themselves, or family members. And so it is a balance of being able to be able to know that metrics are important. If it's not measured, it's not managed. However, I'm a clinician first and foremost, and so being able to balance that and understand, I think I have an understanding and an empathy for the emotional toll that addiction treatment can take on our providers. Being able to step into the fire every day, but being able to balance that with making the tough decisions that I do have stakeholders that do have expectations. And so there's some things you shield. Not everyone needs to know the nitty-gritty metrics of how things run. But I think what it comes down to is bringing people along with you as best as you can, being transparent with where the vision and the mission is for the organization, and knowing that our why drives anything. I'm definitely blessed in that I have ownership here that truly believes in putting clinical integrity and experience over the financial side. And like I said earlier, do good things and good things happen. So we're not a rocket ship. We are a steady moving train, and Dan may attest to that. I don't know, but we're not gonna shock and awe anyone, but we're going to do good work first, and that's always been the priority and the precedence, and balancing those and knowing who can handle the financial metrics, and who needs to be shielded from those in a little bit, so they can focus on our patients more. You can truly see that if you overwhelm someone with metrics, they're not doing their purpose as best as they can. They're not serving as best as they can to the why. So it's being able to evaluate who you have on your team, and knowing what they need to reach their potential and be the best for them to serve your mission, to serve your why, to serve your vision, and being able to utilize all of the aspects that make them special. It all blends together. So it's just intentionality around it. So
you can do both, though, right? You can satisfy both of those things. That's the takeaway that I got. And now,
I would not. You cannot. I believe you can't forsake one and get both. There has to be a balance in everything. And sometimes like Ben said earlier, you have to be able to step back and do a self-evaluation constantly. You can't look at the year at the end and say, what did we do well? What did we do wrong that we want to change? There has to be a constant self-evaluation. And I think, in my leadership team, more leaders than not on my director level are therapists, are clinicians themselves. So we balance the business and the clinical side very well. But you have to be willing to look at your benchmarks. You have to be willing to look at what's the health of the organization. Ultimately knowing our goal, the health of the organization, is defined by our patients' experience here and the outcomes from that.
With that in mind, because you have, and for all the operators that are out there that are tuning in today, I think this is a real important piece. You have a couple of different groups, and you talked about shielding some of them. When you're working on culture building with an executive leadership team or executive leadership level, it's different than it is at the frontline level. How do you manage both of those? What are some of the differences in those that you would do?
There's definitely harder conversations on the leadership team side, but what it is being able to understand our performance metrics as an organization on the leadership side, and how does that translate into how do we inspire and how do we lead first with our teams? How do we have that message in the room together saying, here's how we're going to serve, and in turn, here's how we're going to make sure the business is healthy as well. So I'm not having, drill down budget conversations with frontline staff, but having those conversations about intentionality with directors and other leaders, and then remembering that we have to help foster that sense of hope with our patients, and we have to be those lighthouses of our why. It is a balance, and it's an everyday balance, but I promise being able to step back and look at everything from a hot air balloon perspective, but then knowing the same day in behavioral health, you're going to be on the bicycle riding on the road. That's what's important. A good leader can move back and forth from those perspectives and not stay too long in one.
Yeah, I'll tell you, I love it because we're talking about people, and we're in the people business, like we really are. And this the focus on culture really does bring it back to that we can't just focus on the business aspect. We have to remember we are in the people business. I'm going to shift gears a bit from the people to the business, and Michelle, I'd like to shift gears in here and kind of wrap this up, and then we're going to do a kind of a last minute tag out. But I'm curious with I've heard for years and years this move towards this value-based care and pay for performance fee structures. Can you talk to me a little bit about that? Should providers on the business side, should they adjust their business strategy to manage risk and optimize outcomes? Like, should they be doing that?
Absolutely, yes, in a word. First, we should be measuring our outcomes. You heard it from Dr. Nelson. You've heard it across the board. It's really a lot of the fervor in conferences now. We're talking about outcomes and then how to improve on those. I think that I'm a big believer that you can't be all things to all people. So it's important to truly understand what you're good at, what your facility is good at, what kind of team you have, and focus on that as you approach risk. That right there will give you better outcomes off the bat if you do the things that you are good at and you really focus on what those are. When we think about value-based care, essentially it's all about risk. And that's the thing that I think is hard for providers, because I'm a clinician, worked in providing treatment for 2 decades, and it's ingrained that if you take a risk, there may be a negative a negative outcome attached to that. So we avoid that and we do the kind of safe thing. But for insurance companies who are really driving value-based care, it's all about risk. When you think about it, a health insurance, a payer, their job is to assess risk, and they have thousands of actuaries on staff who are managing and looking at risk. And so one challenge that providers encounter when they think about risk-based structures is that they don't really quite understand how it works. And I think that's really preventing people from taking the plunge. So here's what I would say you have to understand about risk. It is a necessary trade-off and will continue to become more so in order to get the reward we're looking for. So if you want to get paid for providing the best care possible or better care, then we have to be prepared to accept lower reimbursement for less quality care. And that's how the payers are looking at it. And that's how and I know that providers really want to be measured on that. They just haven't quite figured out how to take on risk. So if you understand as a provider clearly what you can control, what risk you can manage, what risk you cannot manage, and tie that and focus on that, you'll be doing better. So for example, if you if you do DBT well, if you have a DBT program at your facility, if you are a rock star at LGBT care, if you are providing treatment to medical professionals, start by focusing on that and take your risk around that. And then create your ecosystem and bridge out into different areas of risk once you have nailed the things that you're good at. So to sort of tie it all together, I'd say this is one reason why it's been so hard to adopt value-based care, because because there's so many variables and most providers have a very narrow scope of control. So even if you have an IOP, you may not have housing, you may not be able to do chronic disease management or even general outpatient at times. And all of those impact the outcomes in behavioral health. But if you don't have control over that, why would you want to take on that risk? So focus on what you can control and consider taking risks in those areas first.
Yeah, I think it segues really well into a question that was asked in the chat, and it's for you, Michelle. It says, with hundreds of possible quality metrics from NQCF, patient-reported outcomes, HEDIS, CMS, which standardized measures rise to the top for demonstrating value of SUD and success in risk-based contracting?
Yeah, so we were really successful early on at a previous health system with negotiating risk-based contracting. It's a tongue tie. And so there's sort of two ways of approaching this. Payers are still saying, hey, what's your length of stay? What's your AMA rate? And then outcomes measurements are largely focused on diagnostics. You heard it from Dr. Nelson, PHQ-9. Some people like Beck depression. Take your pick of anxiety measures. There is a measurement for essentially every type of diagnosis. So payers want to focus on the measurements that are that will get the most care and the best care in the shortest period of time. So I think you'll still continue to see that quality measures are one thing, but that is not what we're seeing risk-based contracting being sort of measured on today. And it's not to say we won't in the future, but right now, those value-based conversations are really around treatment outcomes.
Really appreciate that. And one thing I want to say is that all of the experts here today that are presenting, we could go down and spend an hour with each of these professionals digging into this. And so this show and this vehicle today is just to start the conversation. I really encourage everyone, if you have more questions in here, to please reach out and talk to the experts individually about these things. That one thing you see on the screen today is a whole group of real professionals who are working together to bring some cohesiveness into this industry. And I really encourage everybody to reach out to them, talk with them about what they do, how they're bringing change in their own perspective into the industry. So I know that we're getting close. We got about 10 minutes left. What I'd love to do is I'd love to go around to everybody And I like to wrap this whole thing up, put a bow on it with, can you leave the audience with one or two things that, like, just a soundbite or something that really piques their curiosity or answers a question that you hear the most? And Dexter, I'm going to start with you. And so you got like about a minute and a half to kind of leave the audience with the aha moment for you. So what are you seeing?
Well, I'm not sure if it qualifies for an aha moment, but we're often asked, what can I do to improve the value of my company? And given so many of the things that the panelists have said previously, the number one thing that we urge, beg, cajole, whatever those combination of words can be, is that companies should get third-party independent audits of their compliance and their regulatory compliance, because the thing that's going to derail a deal is going to be compliance. It's almost always that case. And the thing that I want to emphasize is that 99% of the people who are on this are good actors, and they're not intentionally doing anything wrong. But there's a lot of unintentional mistakes that people make, or that somebody might go, you're a little bit in that gray area that was talked about earlier. And the ability to have that done long in advance of a prospective sale gives you the opportunity to make those corrections. And the value proposition on that investment, it's not cheap, but you could be talking about losing millions of dollars of valuation for something that could have been fixed for far, 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 far less than that investment.
Wonderful. Thank you for that. All right, Bethany, you're up.
Sure. So as I was thinking about this, Colin, I was thinking about the thread that connects us. Very rarely do I have to think about some of the hardcore business side of addiction treatment. It's fascinating, and I love getting to learn from people like Dexter and Dan, but it's not something I touch a lot. But the common thread that I see running through everything that we've talked about, all the way from high-level business all the way down to company culture, is a matter of ethics and the standards we're holding ourselves to and the standards that we're putting out and how we're aligning ourselves with medical treatment and how we're interacting with payers and patients. And small plug, we did put out the Ethics Guidebook 2.0. It's completely free on NAATP's website. It's a really great resource just to go and download and look at. I would encourage you to look at those. But, as Dexter said, there are so many good actors in this field. And the fact that we saw this conversation, this thread run through the entire thing, just reminds me of the reason that I love being in this space, because it's always forefront when we're talking about it, no matter what part. And I really appreciate that I got to learn from folks today and share a little bit of what I know.
Wonderful. We're definitely glad to have you for sure. All right, Sam, how about you? What are you going to leave the audience with today?
Yeah, I think it's important to know that you do not have to have an operator or an executive to lead excellent culture in your organization, that it just starts with you as the individual. And so being able to know that, run every decision you make through your organization's why. Connect yourself to the why. Something I do with our new hire orientation that I help facilitate is I show everyone our mission and our vision. And then I have everyone as a homework assignment write their own personal mission statement and their own personal vision statement for how they connect to the organization's mission and vision. You need to know every day what's your purpose and where you're going. And those can be short-term, those can be long-term, and those can be changing. But they need to be something that's difficult but not impossible, and something that you share with others. You have to be able, in our field, we have to be able to march together against the disease of addiction. It's a pervasive disease left untreated, and we all have to be working together on the same marching orders. And so knowing your purpose, knowing your why, it's just extremely integral to us being able to serve our patients, their families, and our communities as best as we can.
Yeah, thank you so much for that. Really appreciate that. A personal mission statement is absolutely huge, and tying yourself to the why. Thank you for joining. I really appreciate that. All right, Michelle, what are you going to leave the audience with today?
I think just kind of hearing all the comments today, and really appreciate the folks in the chat chiming in, getting to know each other. I see some former colleagues. So that's always exciting. Love seeing those names pop up. It makes me think of, authenticity. I talked a little bit about figuring out as an operator or as a facility, as a provider, who you are, focusing on that and doing it really, really well. We hear this all the time. We are inundated on the business side and the clinical side with new software, new tech. We have FOMO, right? So-and-so is doing this, so we've got to do it. We've got to get this app. So I just want to encourage everyone, as we hear about consolidation, as we hear about shifting payer behaviors into other or lower levels of care, trying to figure out how to get reimbursed for things, taking on risk, just assess everything as it meets the business needs that you have. That's my kind of reassurance. So if there's a technology out there that someone else is using and it's not necessarily what you need to solve a business problem, don't take it on. Assess this stuff, but also don't be afraid to take on things that maybe nobody else has heard of. The rest of, other industries have been solving problems that we're trying to solve for many years. So a lot of times what we're seeing is technology from other industries is now coming into the behavioral health space. And so these are time-tested, sort of true technologies, softwares, et cetera. And we just need to really assess for ourselves, is this meeting my culture? As you heard Sam talk about, is this meeting the needs of my team, of my patients and the people who I serve? And is it tying into that mission? So don't be inundated by all of the stuff that's out there. And also look at this group of people. These are people who I have gone to for, sort of asking business questions, thinking about strategic stuff, validating, testing ideas like, hey, Dan, what do you think of this if I did this? Or, Ben has worked with us on solving problems. I mean, everyone on this webinar is an asset and is a resource to all of you. So just consider that as you're tackling these big business problems, and you don't have to do it alone.
Awesome. Thank you for that, Michelle. All right, Ben, I'm going to turn it over to you.
Well, Michelle pretty much stole my whole talk about doing a technology assessment, really making sure that at the end of the day, tech is helping your team, your staff, and directly impacting patient care. And really, you should be looking at a crawl, walk, run environment, test it out, get some internal champions, and then run with it. And then the other piece is I've seen the industry become just so much more collaborative, like Michelle mentioned. We're all here, we're all fighting the same fight. We're a phone call away, an email away, whether you're a customer or not a customer, a colleague, we're all here to make it save lives, at the end of the day. So that's it.
Thank you for
Well, Dan,
that.
I stole your question, stole your answer because I was listening in for that software you have. Just kidding.
All right, Dan, go ahead and take us home.
Other than a quick ditto to all of the above, I do want to reiterate, everyone here is absolutely willing to take calls and just talk best practices. This is not in any way promotion for the groups on this call. These are people that are willing to help you help people. For marketing, quick punch list. SEO, search engine optimization, is still the absolute top converting marketing channel. PPC, pay-per-click on Google Ads, is still the highest volume source of admissions in the entire industry. These will both hold true through the advent of AI until it becomes AIO instead of SEO. Make your vendors interact with each other. You will compound your results and decrease compliance risk. And measure cost per everything in your marketing. If you haven't, it's not too late to start. And compliance. Thank you for complying.
Look, I just want to thank everybody for being a part of the show today, for coming on and sharing this wealth of knowledge. I understand that this is just the beginning. And if you want to get in touch with any of the panelists, we're going to send a follow-up email out after this. Please respond to that, and we'll make sure that you get the contact information for the panelists that was involved today. And I really encourage everybody to dig in. If we were to go through like literally every question on here, we'd be on here for 2 or 3 days going through this and really sharing the solutions that we all have. And we're glad to do that individually. So I just really encourage you to reach out. In closing today, I'll just say that I think that the state of addiction treatment right now is definitely moving forward in such a positive way. I'm real excited to see. It wasn't that long ago that the idea of compliance and outcomes were just something that was like a pipe dream, and now like it's all everyone's talking about. And so I'm really excited to see that. I think that the industry as a whole really is growing and maturing into the real industry of helping others that I think it was created to be. So really excited to see that continued growth out there. Please reach out to the panelists, guys, and really look forward to doing this again next year. And with that, we'll go ahead and close today. Thank you all so much for your time, and have a great rest of your week.